Hi, I'm Dr. Joe Nemeth,
And I'm Dr. Amar Katranji.
and we are periodontists in Southfield, Michigan. And we want to answer some common questions regarding dental implants today. And Dr. Katranji in our office does the dental implants, and they ain't nobody better, that I can tell you for sure. So what are some of the questions we have?
The most common question that we ever get is, how much do dental implants cost?
Well, I'm going to leave that up to Dr. Katranji because I know they're variable depending on many circumstances, and I think there's a reasonable range that Dr. K can talk more about.
Yeah, and I think when we're talking about implants, we're talking about multiple components, and I think that can be confusing when you first come in. When we're looking at implants, there's really three major parts that make an implant. The first part is the implant itself. It looks like a screw, and this portion replaces the root of the tooth. That's the part that we typically do in our office here. In order for us to place an implant, we need to make sure that you have enough bone, which is the foundation, for the implant. If you come in here and all you need is the implant, it's going to be a little bit different than if you need some bone grafting prior to the implant placement. The implant typically takes anywhere from a few weeks to a few months to heal, so up to 3 months, before it's ready for restoration. And that's typically another step where an abutment is made that screws into the implant, and then finally a crown that goes on top. So even though when we talk about implants, the actual implant is the part that goes in the bone, you still need a crown that goes on top. So the costs are associated with the implant, the abutment, and then finally the crown. So how much does an implant cost? Many insurance companies provide certain benefits for patients in order to get an implant, and it can cost anywhere from $1,000 up to $3,000 or $4,000 depending on how much bone material you need or how much soft tissue in many cases you need as well.
True.
After that, the abutment and the crown can cost anywhere from $1,500 to maybe $2,500 as well before you finally get your final crown.
Yeah, so I think probably in the average case, it might be $3,000 to $4,000 for the implant, the abutment, and the crown. Now, if there's a lot of bone loss, as Dr. K mentioned, that would add an additional cost depending on how much bone loss there is and how much it has to be built up. But again, if you need bone, there's nobody better to grow bone than Dr. K. He does a great job of it, but you do have to have enough bone to support the implant. Most people do, but sometimes some bone has to be added. So remember, if you have a healthy mouth, you're going to be able to keep a lot of these teeth, and more importantly, maybe your body is going to be healthier. So call us or contact us with questions, subscribe to our YouTube channel. We'd love to hear from you. We really care about you, and have a great day.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.